So good evening and a very warm welcome to every one of you here. It's nice to see so many people joining in. Welcome to this Tuesday Talks with me, Dr. Ameeta, in association with Joining Hands. As you all are familiar, we've been having this Tuesday Talks for the last 2 weeks. This is the third week, the third session. And these Tuesday Talks with me are on all about past life regression and therapy. Some of you who may be new to this and new to me, a little very brief description about me. I'm Dr. Ameeta Thacker. I'm a doctor, I'm a therapist and a trainer. I'm an ardent believer in mind-body medicine and a holistic healing approach to any ailment at any level of your existence. And hence, whenever required, I prescribe homeopathy and Bach flower remedies when it comes to medicine. When it comes to drugless therapy approach, I utilize the clinical hypnotherapy and regression therapy for helping their minds to mend wherever things are not at ease and not integrated at the mind, body, and the soul level. And I trust that everybody knows how to heal himself. So I also use many a times energy work. I'm also a family constellation practitioner. And more about me, you can look on to the website of mine, which is Soul Mind Magic. I practice at Goregaon. I have a healing center there. And that's where I operate from for private sessions and training workshops. So happy to see you all today. And today's topic is the different schools of past life regression therapy, or rather past life regression to be precise. Well, when I go back to my first session, I started with what is past life regression. If any of you have missed it, please go and watch the recording so that you know the basics of what is past life regression. Followed by which we had the session on the need for past life regression. And that's also something that will give you answers and all your queries about when to approach a regression therapy. When do you go for past life regression? So in the line of that, which I ended my last session with, it's ultimately your choice, right? And when you make a choice to go for past life regression, you obviously would come across many different regression therapy approaches. Well, as a layperson, many of you would not be aware. And hence, I thought of giving you an exposure to the different approaches that are there available in today's situation with the past life regression work. So let me make it very simpler first. When it comes to past life regression, exploring your past, there are two main approaches. One is where you actually go through the past. You're reliving the past. And the other would be there is somebody who's giving you an information about your past or past life, to be precise, in the form of a prophecy or a sermon, which some of you would have come across. And the approach that I call as past life regression as a prophecy, which means somebody suggesting you that, this and this situation in your life is because of these things that you may have been in your past, which we often come across when we go to a tarot reader. There are a lot of astrologers who tell you about, based on your charts that, this is coming from your past life. There are some astro vastu readers do that as well. And you may have come across Akashic reading, which is one of the a little more in-depth, kind of way of looking into the past life of your client or the recipient. So these ways are basically non-trance inducing way of accessing a past life. The other approaches are by and large through taking the person actually into the regression, which is reliving the past. Before I go ahead a little bit about it, and I already introduced the two broad classifications or approach to past life. Let me clarify one thing, that past life regression approaches are varied which does not mean one is better than the other or one is the right way or the wrong way. The scope of each approach is different, and it is applicable as per the suitability and the inclination of the recipient, which is the person who's approaching for their healing through past life regression. Someone who doesn't want to go through the process for their own reasons, would prefer, kind of getting to know from, somebody who would in their trance look into their past and tell this is what happened, which is what I tell you as PLR, as a prophecy, as somebody sermonizing you, giving you an information about your past, and then giving you a remedial correction for that by asking you to do some prayer, chanting, mantra, some way to kind of cleanse off the vibrations which are still stuck in your past. Okay, many of you would have come across that to begin with, and then once you are now getting exposed to the past life regression therapist who actually take you through the reliving approach. There are also few schools of thought, because each one of them, there could be an American school, there could be a European school. Now, each of them have a certain way of looking at regression work. So I'm going to now talk about that. To give you a little more idea, you would see some regression therapists taking you through the induction route, and then through the induction taking you into your past. And they would say, today I'm taking you into a past life regression. There would be some regression therapists who would not tell you that today we are going into regression into your past life. They would start with a symptom which is expressed through their intake in your conversation with you, and then from there lead to the source of the issue, which would unfold on its own into a past life. So these are the categories that you come across. So many of you would say, oh, when I went through this, this happened, and when I went through this, this happened. I don't feel it really kind of connected with me. I don't feel I went deep enough, because there are different regression therapy schools. So the first one I have already introduced, which is non-trance induction, where somebody is going as a therapist or as a reader, taking themselves into a trance and focusing on the client or the recipient's past to give them an information about their past. So there is nothing as a regression or reliving done, which apparently feels safe because you feel you're not doing it and you're free from the trauma. However, there are benefits if somebody goes through the regression approach, which is reliving the past. So many a times we have often heard that, when you come across a situation which is not getting healed, or rather you keep getting stuck into a certain situation, then obviously through your tarot reader or your astrovastu reader, or maybe an Akashic recording, or somebody maybe just out of their general intuitive way of suggesting you as a friend or a counselor, telling you, why don't you explore your past? You choose to go through regression approach. And even in that regression approach, there are regression therapists who would only touch upon that particular situation. Let's say if you have an issue with your partner, or if you have an issue with somebody very close one, or maybe there is a betrayal, they would take you through that process in the regression and explore only that specific area through a certain way of induction and going beyond into that life. And many a times, the client is not taken very deep into the trance, because having to go deep enough may be very, very traumatizing. So there are regression therapists who would operate by regressing you into, not taking you deep inside into reliving it, but watching it from a distance. So it's a dissociative approach of doing past life regression. The benefit is you don't really go through the trauma. And the disadvantage at times is sometimes there are very minor situations which are even there in the body stored as a trauma, and they may not get released. So sometimes it may work, or just by knowing it, just by getting enlightened by the fact that this situation which happened with so and so person, or this trauma is coming from the past because so and so thing that I did to that person, or that happened because of this, and you get to understand it, you get enlightened. So that's called as PLR, for the enlightenment, knowing purpose, just knowing it by watching it from above. Now, the third approach is where you actually relive in the regression work, which means the therapist takes you through a certain process, either induction route or just to the symptomatic route, and the past life gets unfolded and keeps you in the trance of that moment and of that life, which means you are so much there, or by and large, a large part of you is there. So you are reliving every bit of it as if you are actually there, and you're feeling it in every part of your body, you're feeling it in your mind, and then you're so much connected to it. So the benefit of it is you actually relive, you start believing it's working for you, and that itself starts the beginning of the therapy session, or freeing from that trauma, which is called as PLR through talking it out. Now, the disadvantage is when you're really reliving it, you're re-traumatizing yourself. Now, that's not a very sadistic approach, because therapists are trained, how to not really put you so much in trauma. So sometimes it gets so intense that the therapist would bring you out. So the benefit and the disadvantage is that, reliving helps you to believe and release there itself as you are talking out or going through the process. But the disadvantage at times that it becomes too much intense, that you want to come out of it yourself, or the therapist also then brings you out and starts letting you watch it from the distance. So that's PLR through talking out, which many of you would have experienced. And maybe many of them don't opt for regression because they say, why do you have to go back to the old past again? Having said that, there are a lot of therapists who also would continue if the client is willing. By the way, the regression therapy is the willingness and the inclination and the need of the client. And the therapist can really gauge that well. A good therapist would definitely have a good comprehensive pre-therapy, understanding of the client's need and what is the client's situation. And maybe if required, would also make the client rework through the reliving route, which means they will make the client go through this regression of the past life 2 or 3 times to the same life, because maybe once it was too intense. Whenever you go through any certain experience which was painful in the beginning, if you go the second time, the third time, the fourth time, the impact of it gets diluted. And what happens? You get desensitized. So there are therapists who would take you repeatedly in 2 or 3 sessions consecutively to the same life, maybe through the same situation or through different parts of it, so that you can release the trauma systematically and in minute packets, so that you are free of the intensity of the trauma in a sequential and a systematic manner. And the huge benefit is you get desensitized by that trauma and you're free of it, whether it's at the mental level, emotional level, or the physical level. It benefits mainly when there is a physical trauma, because the body holds the memory of that physical trauma from the past, and hence it is required to re-stimulate it and repeatedly go through it. Many of the mental and the emotional trauma, if they are not of great intensity, would be very efficiently be dealt with going through regression by talking it out, to just having to go through it once. So I've covered so far PLR as prophecy, which is somebody else going through your past life. PLR, which is through just knowing and understanding, watching it from a distance, but you are still going through a trance, but there is a way to watch it from a bird's eye view. The third one is you actually relive into your body and your mind, which is PLR through talking out. And there are times you have to repeatedly go through it, which is to the extent of extinction of that trauma, which is called as PLR, as an extinction route. Now, the next one that I'm coming across is the PLR, which is for the sake of catharsis. And I would also mention the PLR, which is a necessary way to heal each and every issue, which also includes the underlying patterns and themes. Now, the PLR as catharsis and the PLR, which is essential for every symptom or every theme, generally comes in the context of transpersonal regression therapy. Now, this is what I primarily practice, because in the transpersonal regression therapy, there are a lot of benefits. One, we take you through a route where we enter through the symptoms which are very precise. We start, before taking the person into regression, taking a detailed intake to pick up the primary symptoms. And once through that route, we are taking you through a regression, which is reliving your past, which is what we already mentioned in PLR talking about. So we include in this transpersonal regression therapy, which is useful for catharsis, as well as it is essential for healing all the symptoms and themes and patterns, where we include both the approach, reliving through the body, and sometimes if required repeatedly, at the same time reliving through watching it from above. The benefit of this is that you are able to cathartize. What is catharsis? Or cathartizing is letting go, purging of the source of the symptoms deeply, completely, and systematically from the body level, from the emotional level, from the mental level, and many a times even at the soul level. So there is a complete catharsis happening through the transpersonal regression therapy. And hence the outcome of this therapy is where you find physical peace, because the body has been able to systematically discharge all the charges which were coming from the previous life traumas, which were held in the muscles or wherever, whichever part of your body that is holding back. The second is, by reliving it again, it is also releasing the mental and the emotional trauma. So as one is releasing the physical residues of the previous lives, there is suddenly, with the clearing of the body consciousness, a lot of mental consciousness is also getting revived. There's a lot of clarity coming on itself. There's an understanding coming as to what happened, how it happened, and why it happened. To the extent, many a times, once you start getting this physical catharsis and emotional and mental catharsis in the transpersonal, we also sometimes, if the client is still ready to go through, as I said, every therapist will gauge the capacity of the client in the same session or the later session to explore what are the choices that were there that could have been applied or they were not applied. In other words, you also get a lot of spiritual catharsis, a knowing of why that life happened the way it happened, and maybe the connection with some other lives. In other words, you go into resolving patterns and themes which are connecting between the lives and having an impact in your present life. So the transpersonal regression therapy is basically, in a way, a wholesome menu of resolving your present, which is impacted by the past, at different levels, at the level of body, emotions, mental, or even at the spiritual level. So what happens eventually as an outcome, there is peace at the body, there is peace at the mind, there's peace at the soul. So there is a lot of clarity and understanding. So it's in a way a very deep healing approach, quite intense, but more or less complete. Now, this depends upon, as I mentioned to you, how much is the client ready to take in, digest, and assimilate their previous life trauma. So many a times we gauge as therapists, not to judge the client, but to understand where they are what are they ready for? And maybe we introduce these kind of sessions a little in the second or the third or the subsequent sessions. So the first session is about understanding and listening to you and having different interventions which are accessing you to connect to your own self. And once we have got a good harvest of symptoms, we then slowly stick to the source of that symptoms, accessing the past. Now, these are broadly speaking the 5 to 6 approach of past life regression. None of them is superior or inferior. As I said, none of them is right and wrong. It depends from client to client, their openness, their willingness to deal with their situations. And many a times, once you have been through several regression therapy, you yourself start getting aware and more present. So sometimes simply knowing it itself is enough, and then you can do it some self-work on your own. I think some of you and many of you have been exposed to Ho'oponopono. That's one of the ways that one would suggest, just by knowing it. Or somebody would say, why don't you start doing this work, of Ho'oponopono? And you will start clearing a lot of past life residues. But that is very generic. But you can apply these generic and specific ways of dealing with your past from time to time and continue your self-work, continue in your journey of expansion and soul growth and evolution. So that's where I end this topic today. I think I've tried my best to make it very simpler for all of you to get an understanding of the different approaches that are available in today's scenario when it comes to regression therapy, or just regression about knowing your past, either through somebody else and primarily through you. Highly recommended is to experience it at least once, because once you experience, it's like once you have experienced it, it never leaves your bone, it never leaves your muscle. And that experience itself gives you belief, the faith, and the ability to access on your own a lot of insights which were possibly not there. So it opens a whole lot of awareness when it comes through reliving in regression. Okay, so thank you so much. And I welcome if there are a few questions, maybe I can take one or two of them depending upon our time today. Komal, are you able to help me with that? Let me see on the chat. Okay, I don't see any question, which means I guess it is.
Can I ask you a question? Yeah, I wanted to know about more. Can you touch upon transpersonal regression?
Yes. So transpersonal regression therapy is based on the understanding that your present day personality is in charge and requires to be in charge in every moment. And your present day personality, when it is not in charge, what do you mean by that? So if I have to give you one very simple example, I think the question came from Mridula.
Yes, yes.
Okay, so if I may ask you, how old are you? You may tell me your age, or you may not tell me the true age. So how old are you?
You want me to tell?
Yeah.
Yeah, I'm 60 plus.
Wow. Okay, so if you're 60 plus, okay, if I have to now ask you to be with yourself as Mridula, what part of Mridula is 60 years? So if I tell you as Mridula as an individual have a body,
yes,
have a mind and a soul.
Okay.
So who is 60 years old?
I don't feel that.
Wow, that's interesting. So even if you don't feel that, that's your mind not able to feel that, that's great. But if we have to do carbon studies on your body,
yes,
it will say it is 60-year-old.
Yes.
The soul doesn't have any age, right?
Yes.
So the mind is left to freedom to perceive and receive as much age the body is, or that's the freedom that you have. But many a times, even if you want to, you are not able to live that age. You either regress into acting like a 4-year-old, maybe a 14-year-old, or a 40-year-old, or a 50-year-old, or maybe an 80-year-old. Correct? Are you getting it?
Yes.
Which
yes.
means at a given moment, and at every moment, the soul, which apparently doesn't have age, but it is all the time there present to the body has a certain age, and the mind are not in integral consciousness, which means this only the software of the mind keeps floating, right? So at a point in a given present day moment, in this moment, if one is not fully present, something else takes over your body through the software of the mind. And that could be for a good long time, which you are not in control of, which means your present day personality is not in charge in a certain contextual situation. And that some other program of either the 4-year-old, 14-year-old, or maybe it's coming from somewhere else, which you have no clue and it doesn't make any logical sense. It's taking over your mind in a certain situation, which it keeps getting triggered again and again. Which means in the present day moment, or every moment, or in a certain moment as you live through, there are certain software that gets triggered, which are out of your control, which may come either from 3 areas: the past life, maybe from early childhood, intrauterine life, or maybe from some other program. Now, this is not known. So the transpersonal regression therapy is about regressing you from that presenting issue, and slowly through that issue taking you into a trance-like state, which takes you where that state has got emerged into, and getting to the source of it. Is this clear?
Yes.
So it in a way, it brings the personality back in charge once it frees the personality of the hanging program of the past life, or of the inner child, or of the other extraneous programs. And it slowly brings you back into present moment and frees you of the limitation of that software in the mind. And that's how you have peace in the body, because the work that is done in the transpersonal is done at the level of body, mind, and at times required through the soul.
So, okay, thank you.
So most welcome. I'm glad you asked this question. We'll have a little more detailed understanding of it when we go into further topics. The next topic that I would be conducting would be about difference between hypnotherapy and regression. It is overlapping somewhere, yet it has some little distinction. So once I take that topic, maybe I'll add a little more on transpersonal regression therapy, or I'll follow the next session to that with a little more on transpersonal regression therapy, what to expect, what not to expect. Okay, so thank you, Mrudula, for this question. I hope it has been answered.
Yes, yes.
And I think we are coming to the end of the schedule for today. Komal, is that fine?
Yeah. If anybody has any other questions, they can reach out to you through the platform.
Absolutely. If there's a little delay in this week to reply, pardon me, because I am beginning with the training program from tomorrow onwards, which will go on till Sunday. But you're free to connect to me on the platform, or you can even leave a message to me. Good luck. Have a great evening, great week. See you all again next Tuesday. I hope to see more of you. Bye-bye.
Bye-bye. Thank you.
Thank you.